Food choking is surprisingly common. One child dies every 5 days in this country from choking on food. About 10,000 kids each year visit the emergency room from choking accidents. If it were my choice, kids can be on baby food till they're 12. This is not possible, but we do have to have some guidelines. Unfortunately, there are no guidelines set from the FDA or from the CDC regarding what is safe for children to eat. My recommendation is that toddlers, and by toddlers I mean kids under 3, should not have candy of any kind, no lollipops, no nuts, no popcorn. Raw vegetables, you need to be very careful in kids under 2 or 3 also. The most common way to have a choking accident is a child who's running around while they're eating. So the best way that you can prevent that is to have your child sit while they're eating. If they're running around while they're eating, if they're sitting in the back seat of the car while they're eating, you will not see them if they choke. You will not hear if they choke. By the time you realize that they've choked, it could be too late and they may have already stopped breathing. The car is not a place for a child to eat. The playground is not a place for your child to eat unless they're sitting down with you. Look at your child while they're eating. The choking accidents that kids have can be silent.
Well, airway obstruction in infants and children is unfortunately too common an event. There will be different and perhaps many challenges to a baby or child's airway during their life, but there's a point at which we have to, as parents and care providers, step in and actually remove these items. That can happen by a number of means. First, quickly take a look inside the mouth and see if there's anything that you can visualize and get on your own. If you can, go into the mouth with the small finger, baby finger, hook around the item and try to pull it out. If that is not working, then it's immediately necessary to turn the baby in a gravity-friendly position, supporting the head and neck with one hand, and strike with moderate-sized blows right between the shoulder blades, up to 5 times. 1, 2, 3, 4, 5. Turn the baby so they're face up, still pointed down, and push on the CPR spot up to 5 times. 1, 2, 3, 4, 5. Check the mouth again for any changes or the possibility the item is now gettable, and we'll go from there. Continue this effort of back blows and chest thrusts until the item comes out or the infant or child becomes unconscious and lifeless, at which point CPR is indicated. We go directly to 30 pumps and attempts to blow air in twice. The removal of an airway obstruction in a toddler or a bigger child has similar kinds of consequences. We must get it out during a very short time frame. However, the recommendation for older children is to use the diaphragm, or the muscle that supports breathing. The diaphragm sits right underneath the lungs. And what we do here, and this is similar to how we would manage an adult, is to take just the lower part of your heel here and put it right between the belly button and the bottom of the breastbone and pull up and in at the same time, like that, which drives the air pockets that are stuck in the lungs up towards the offending object and hopefully knocks it out. That's the goal. Should this not work, and the victim become lifeless or unconscious, that person gets put, in this case, on the ground, and we start pumping on that chest, doing the same CPR, except with a little bit more pressure, given that it's a larger child.